So let me start by just a question for everyone. How many of you have any kind of responsibility for communicating data to somebody else? It could be your boss, it could be, okay, cool. All right. How many of you are happy with the way you're able to communicate that data? Like you feel like, okay, this works well, I'm able to make my point, this is working. Anyone? One person? Two person? Okay, all right. Half a person? Okay, good. Great, that's good to know. I face that same thing, and the reason I brought that up is because for about the past decade, maybe a little bit longer, I've had really the pleasure of, in philanthropy, I'm Andy Krakoff with the California Healthcare Foundation, I should have mentioned that, but I've had the pleasure of working with communities across California to help them better leverage and use data for their, whatever the purpose may be, health data. And from that, I've really been able to, I think, grasp the difficulties that they face in communicating data, humanizing data, and really kind of mobilizing action for data. And the mobilizing action could be to change behaviors locally, raise awareness of issues, inform policies. It's really difficult stuff, I think, as we all know. And because of that, I think what we all end up doing, and I'm not casting judgment on this at all, this is a very nice PDF data report, it really is. You know, it's nicely done. This is the California Department of Public Health's data report, the burden of chronic disease and injury. So what we do is we all end up going to what may be familiar to us, is that we communicate data this way. And what we're learning is that there are other ways to communicate data. I'll be showing other examples. We'll all be showing more examples like this. This is one that was done in Sonoma County. It's a farm workers' health survey. And rather than doing it as a PDF data report, they presented findings in a much more visual kind of way that incorporates text, incorporates photos, and also incorporates data. So what I know, though, is I can really appreciate why it's so difficult to do this kind of thing. Because first of all, traditionally, I think what's happened is we've all spent a large amount of time first trying to find the data source. You know, what's the data you need for this? And then, so you get that, and then you've got to sort of harvest the data. You got to be able to get the data and use it in your work, right? And then you got to analyze the data. And so you're using up this much time, and you have a tiny bit left in the fuel tank, meaning money, energy, staffing, whatever, to do the actual communication of the data. So that part, basically, of course, it gets short shrift. So what I'm seeing now, especially with things like open data, is that these beginning stages are getting a lot easier, right? So as opposed to taking this amount of time, it takes this amount of time, and that means we can spend this amount of time on the communication piece. So what we've been doing as a foundation, the California Healthcare Foundation, is we've been trying to spread some seed funding across California in various ways to help nurture new ways to communicate data with the hope that these new ways can form impact of some sort. And so I wanted to have this panel because I really thought it'd be a wonderful opportunity to hear from the folks who are on the front lines doing this work, the folks to whom we've been providing funding. And so let me introduce them. So first we're going to hear from Joel Riphagen from Code for Sacramento. And Joel, we've been doing this interesting project, and it's really kind of quite a challenge of helping the state get their health data, the data that they're releasing quite well now on their open data portal, getting it leveraged and used locally for action. And I'll explain a little bit more about that in a minute in introducing what Joel's been doing. But then I also, after that, we're going to turn a little bit to specific work that county health departments have been doing. Really inventive work to basically communicate data in the form of stories, kind of like this one that I showed you from Sonoma County. And for that, we have here Dal Fleming. Dal is the director for the Office of Strategy and Innovation for San Diego's Health and Human Services Agency. And we have Matt Willis, who's the public health officer for Marin County. So what we're going to do is we're going to first start with Joel, and then we're going to turn it over and go to the county-specific stuff. And then hopefully we'll have time for questions throughout. So let me tell you a little bit more, because I think it's a real interesting challenge of what's going on with the state of California. So the state have been really, really big time supporters of open data for the past year and a half or so, and have launched a data portal. And as some people may know, it's when you're the state of California, you really have a treasure trove of data. Whether you're a hospital, a school district, health departments, there are all kinds of regulations that would require sort of data to be reported up to a state level. So they have this treasure trove of data that they are now beginning to release. And so we wanted to find out how could we support the local level use of those data. And it's not as easy as you think. We know how this kind of goes, open data works at a city level. You have brigades. The brigades often can meet in City Hall. There's these physical entities, there's this sense of community. But when you're the state of California, and there are thousands in some cases of municipalities, the state is sprawling both geographically and of course population-wise, that kind of play isn't really as easy to do. So what we tried to do is to see as a foundation if we could help build a bridge between the state and what they're doing in terms of publishing their health data and all the work that could be going on locally. So we created this Health Data Ambassador program. The idea is to have data ambassadors at a local level who really know their community, empower them through seed funding and otherwise to convene people, run code-a-thons, build apps, et cetera. The idea is so that you can have the data flowing one way from the state being used at a local level. But what's been really interesting about this is that you could also then have feedback going the other way so that folks at the state in Sacramento can get some real-time information about how this data is being used and what they can learn. So we have these brigades right now, I'll call them brigades, these ambassadors in Fresno, Los Angeles, and Sacramento, and soon we're going to be adding San Diego and likely San Jose as well. And Joel has been helping to coordinate all this. I want to give a nod out. I don't know if Brian Perchia is still in the room, but I want to give a nod out to Brian as well. Perchia Communications is the organization that's sort of our grantee who's doing this work. And we recently, Mike Wilkening, who's the undersecretary at the Health and Human Services Agency, he and I just posted a blog post on this about how we've been able to work together. This is on TechWire. Well, let me turn it over at this point to Joel, and then I'll probably have a few questions for him. And take it away, Joel.
Thank you, sir. Thank you. Hi, Joel Riphagen. I'm with Code for Sacramento, as Andy said. I am very excited to be here and to tell you a little bit about how excited I am to be here. I had a 15-year career in state and local government, and most recently I worked for an agency that was very conservative, particularly very conservative in its approach to data and how it released it. When you're used to having the press, let's say, review you critically on a regular basis, you become leery of giving them more tools to do their job. And this, it's an understandable response, and you sort of get why they're afraid of opening up this data that they haven't even analyzed, and what are they going to find, and it's a scary thing, but it's frustrating because it prevents you from being able to communicate effectively with the people you need to communicate with. And so when I left that job for greener pastures and I fell in with Code for Sacramento, and the founder of Code for Sacramento, Ash Ragani, mentioned this Health Data Ambassador program, I was really excited because it was an opportunity to help an agency, a state agency that was dedicated to getting its data out there to actually connect it to the community. So I'm very excited to be part of this program. So the problem that we face, very simply, is that the state has a ton of data. The Health and Human Services Agency has data, as Andy alluded to, on vaccination rates at your local school, on MRSA infection rates at hospitals, on seismic ratings of hospitals, on just anything that you can think of. They've got a ton of data, and they're working very hard and very diligently to get as much of that data out on this open data portal as they can, as quickly as they can, and it's phenomenal, and they're way out ahead of a lot of the rest of the state. But when it comes down to it, a portal is a means and not an end, right? I mean, it only is effective to the point that the people who can use the data know it's there and it's in a format that they can use, right? And so that's the problem that we're trying to deal with as these health data ambassadors. And so we've done this in several ways, as Andy alluded to. We began by holding a roundtable where we invited local health and social services representatives, and we got them all in a room and we said, what do you want from the state? And when you ask locals, what do you want from the state? They tend to give you a lot of feedback. And a lot of that was stuff that we just couldn't deal with in the scope of this pilot project. There are a lot of good ideas for maybe longer term things that we might do, but we're talking about federating data at the state and the local and the federal level, and doing all these interesting things that might happen at a later date. But we did at least hear a few common themes, and one of them was that they just wanted some tools to be able to tell their local individualized data stories in ways that were sort of simple for them to use. And so we iterated on that a little bit, as you'll see in a moment. We also held a hackathon sort of in parallel, where we asked the tech community what they might do with the data. And we've got a bit of a slow connection, yes. And so we held this codeathon in conjunction with Health 2.0, where we had coders come in and tell us what they can do with the data. And it was a very successful hackathon. We had folks come even from our suburbs here in the Bay. It was cool. And Sacramento's the core. So people created these dashboards where you could see what the state was doing and how the state was doing on several indicators. There was a mobile app from this Apptology for WIC beneficiaries, where they could see on their phone the closest WIC retail locations. They could see where the WIC offices were. And there was this really cool submission from a local developer called Rocket Department, which was a physical map of California. In this weekend of this hackathon, they laser cut this wooden map of California. They covered it in LEDs, and it can display data from the state's open data portal on this map. It's very cool. It won the Audience Choice Award. And I would just love to see this thing like 2 or 3 times as big, like sitting in the state capitol or sitting like in a public square and people walking by and just like seeing what's going on in their state. So cool stuff happened. But back to what we heard from the community, we also created a way to sort of visualize and use data from the state. And I'm a little bit at the bottom of the page. So we chose asthma emergency department visits, which is one of the data sets that are available on the data portal. And we just tried to create a story about it and show how you could use this data in a more interactive and sort of useful way. So it begins after the little intro, and this computer's a little slow, after the little intro with this sort of card theme. So you begin with these cards, and you can sort of scroll through these cards, and you can see one story of asthma. So it begins with, a little bit of the intro stuff. You got like where emergency department visits fit within the spectrum of the different things you can measure related to asthma, gives you some of the big numbers, and then you can start exploring the geographic story. You can see, asthma rates for adults in California, and then you go to youth asthma rates, and you can see how much higher they are. And then you sort of start digging in a little deeper. You look at the zip code level, and then we take you through different areas of the state and say, wow, look at Imperial Valley, look how high the asthma rates are there. Or in LA, it's all sort of one air basin, but the asthma rates are very disparate, and you sort of get the sense that it's not about outdoor air quality so much as it is about a lot of other things. You look at the Central Valley and look at the high rates, and again, you can see the disparity like in the Bay Area as well. And we also have this little feature where you can tweet that specific slide. So if you're interested in that part of the story and you want to tweet it to your legislator, you can tweet out this link and tag your legislator, and they can see exactly what you were looking at and exactly what you're talking about. So we think that's kind of a cool feature. Before I want to get off this story, I want to show like this thing is something that I was not aware of before I started working on the project, but once you start looking at the data, it's quite obvious that there are these huge racial and ethnic disparities in asthma rates throughout the state, and the African American community has so much higher rates than the rest of the groups, and it's sort of surprising. It's the thing that jumps out of the data when you can just see it. And so then after you go through the slides and you see the story that we're telling, you can sort of start creating your own. So you can go into the interactive map and you can look through just a little demo here. Let's come on over to the Bay Area. Seems like an appropriate place to go. And you can select zip codes that you're interested in, say, and you can say, oh, I'm interested in Oakland. I want to see all these rates. And as you select them, you'll see they appear over there on the side, and then you can download the data related to just what you're interested in, and you can continue your own analysis. So we've got sort of the story for the basic user, and then for the more sophisticated user, you can sort of begin to tell your own story using the data. And then to sort of finish up the user journey, we've got a where do I go from here. So if you're interested in asthma treatment, you can see where to go for there. If you're interested in what the state is doing, you go into the plans and solutions. If you're interested in finding more data, you can go through these data sets. So that's sort of what we did. And that's really just the pilot of this project. And in the process of doing this, we didn't just look at the state's problem, we also learned sort of how to approach a problem like this. So where you've got the open data portal, I sort of call this our open process portal, which sort of records everything that we've done. You've got sort of like the ODP and the OPP, if you're down with that. Thank you. And so there you can see our blog from us and all the other data ambassadors throughout the state. You can see what we've been doing. You can see actually our agile process for developing the asthma site. We've got all of our sprints, what we've done. And you can actually see the different iterations. You can see our first mock-up, our second mock-up, all the iterations. You can see the YouTube user session. It was sort of a way to communicate to the state how this kind of thing can be done sort of outside the standard state procurement process. And another cool thing, and probably the most useful thing to those outside of the project, is this Health Data Project Toolkit put together by Perchio Communications for the most part, that is a way of onboarding new ambassadors as we expand the program. But it goes through the resources that are available. It goes through how to set up a roundtable. It goes through how to publicize. It goes through how to create your first product. And so if you're interested in doing something like this, like having your own health data ambassadors or whatever data ambassadors you might want, this might be a good place for you to look. In any case, we've sort of finished up the pilot phase of the project, and I'm excited to see what we do in the next phase. Thanks.
So, well, first let me see, any questions? We're going to turn it over also to the counties because I want to give them some time as well. But any questions for Joel before we start? All the way there in the back.
Just a quick question. Could you tweet out or something the links to these?
Absolutely.
Easy one. Okay, let me ask you a question. What's been, so I should say that the state have been truly wonderful to work with on this, very collaborative. But whenever you're trying to work with any kind of government agency as an outsider, there must be sort of challenges. And I'm curious to know what's been hard about engaging the state in this work, and what advice in essence would you give to others who perhaps are taking on a similar kind of initiative?
Right. Well, when you go out and engage with the community, you really are sort of signaling to them that you're going to be able to be responsive to what they give you, what they're sending to you, and the state has some people who are really committed to iterating on this and really committed to moving the process forward, but it's a big ship for them to turn, right? And so as we go out, some of the fear is sometimes you go out and say, what do you want from the state? And they say, well, we want this. And we say, well, we can't give you that. And it's not necessarily that it's the fault of the people in the state, it's just that's the nature of the system. And so you sort of have to understand that you're going to be going through this iterative process. And if you get feedback from people saying, we want X, can you create that? If you've got a contractor working on sort of an iterative agile basis, are you set up to give them feedback on a regular basis, as they need it to sort of change their direction? And so I would say that the state is definitely moving in that direction. They've got the people who are really dedicated to moving in that direction. But I think it'll help if we can continue to provide them with successes that they can point to and continue to turn the ship.
Well, as you've pointed out to me, not surprisingly, when you're working at a local level, you want data as localized as you can get. We happen to have a measure here that has zip code level data. That is not always the case. And I think, when you're working with a local community, that's probably something that you've learned. You can't always get the data that they need, right?
No, absolutely. They're working at a local level, and they don't want data on the asthma rate at the county level. They want it at the census tract level. They want to be able to see the difference between communities. They don't want data on Asian and Pacific Islanders necessarily. They want data on the Hmong community, on the Vietnamese community, on the Russian community or the Mexican community, whoever they're interested in serving. And to a large part, it's you run up against privacy issues and HIPAA issues. And like the state, to their credit, they've got a data de-identification working group, which is going through their data and trying to figure out exactly what level of detail can we provide it without, violating privacy. So it's something that, they're very aware that they need to do, and something that the locals are very desirous of having. But again, it's something that takes some time and some work.
Good. Okay. Thank you, Jill. So we're going to turn now to something that we've been doing with counties in California. This data ambassador model is just one model. Another problem that we've unearthed in talking with local health departments, and some may know that when you're a local health department, you both possess and have access to a large volume of data, and you also have this responsibility to try and get these data leveraged and used at a local level so that people can become aware of these issues and policies can be changed locally using these data. So what we found is that they have these great data, they have this desire to encourage use of the data, but they really do face this challenge in communicating the data, which is a big challenge, not just as, when I asked you the question at the beginning, it's not just a challenge that if you're a county health department, it's a challenge for all of us. But I was talking with an epidemiologist, and she said it perfectly. She said the hardest thing for a data person to do is to speak English, and the second hardest thing for a data person to do is to write English. So true. So what we've been trying to do, and so I think as a result of that basic conundrum, is you get reports that are like this, that are sterile. I'm not suggesting that this particular report is sterile, but we know what a data PDF report typically can be like. And they also are one-off reports, right? This is a moment in time, and that's what this is. So we wanted to see how we could help county health departments move beyond that, using videos, photos, the capacity to drill down, in essence, sort of modernizing the whole process so that you could have a report or a data fact sheet or a story, as we sometimes like to say, that's truly interactive and that can be easily updated and it's much more efficient. Here's one example of a story. I gave you one before. Here's another example of a story that we've been working on with counties. This is on C-sections. And this is one that combines a lot of data, a lot of photos, illustrations. You can drill down. I picked data from Alameda County in this case, but I could have picked another county. So in essence, this is showing hospital data for Alameda County. And it even also includes, if you scroll down, a video. So that's the kind of thing we've been trying to do. In essence, trying to bring together, to bridge the heart, where I think, as we know, a lot of decisions are made here, right? So having elements in a report that can have that can show some of that, and also bringing alongside the data that we know we need to weave in there in order to truly inform local decision making. So what we heard, though, or what we know, is that simply having the technical platform, and we're using a platform called Live Stories for this, which has been terrific. It's a data story building platform. And as good as it is, simply having the technical platform is not sufficient. And for that reason, through this project, we're working with 7 counties. We've also been wanting to really sort of build up the capacity for counties to communicate data, to train them, to give them opportunities to work together and learn from each other, to see what stories they're working on. And for that part of the project, we've been having the Public Health Institute, located close by, also involved in this project. So I thought it'd be really interesting to hear from 2 counties that have really been going through this, and we'll start with Dale from San Diego. I'm going to drive for Dale, but she's going to tell you about a particular story that they've been working on. So,
all right.
Go to it.
I think I violated the number 1 rule for a tech conference, and that I brought a paper handout. So. And of course, I can't drive my own tech presentation, but I can talk about it. Bottom line is, in San Diego County, we are a very complex county, 4,200 square miles, 15 minutes from the border, 3.2 million people. over 100 languages spoken. So we have aligned our entire region around a vision, Live Well San Diego, a region that is building better health, living safely, and thriving. And in like most things that we try to do in our county, we try to take data-driven approaches. So we're measuring outcomes over time, and we have invested quite a bit in the mining and analysis and reporting out of data. We can move on to our example. And right now, that data is presented to the public en masse in volumes and formats that aren't necessarily friendly to the general public. But they're beautiful and well constructed, Leslie. Our one example today is this beautiful 55-page report on suicide. It's filled with charts and graphs and numbers and a little bit of a narrative that would make anyone seeped in this space of work totally excited and thrilled. It has everything that they need to know. But on the other hand, it can be somewhat intimidating to someone who's not that deep into the subject, and so dense that the story behind the data can get lost. So contrast this presentation, this paper presentation of the data, with this presentation. This is the live stories presentation that was created on suicide and self-inflicted injury. And note that it's simple, it's clean, it's engaging with data and information. It includes a call to action, and importantly, it tells a story, and it tells it at the sub-regional level. So this is what we call harmonizing the data, bringing it together in an easily accessible way to humanize the data, using data as a tool for information and education, and as a catalyst for engagement and action. So products like live stories help us in the county stick to 3 principles that have made our Live Well San Diego region just buzz and grow from one community partner when we started in 2010 to now over 140 across all sectors: business, education, other governments, community, and faith-based organizations. And those 3 lessons, or those 3 principles, are: number 1, keep it simple. Because in order to communicate across all those sectors and disciplines and cultures and levels of education, it needs to be very easily accessible. And number 2 is keep it local. Yes, health matters, but it matters to me in my community, in my neighborhood, and my region. What can I do about it? So we need to provide as much sub-regional data as possible. And then finally, keep it real, because this is a long-term approach. We need to be agile, we need to be flexible, we need to take on new tools and new methods to reach our community. So we need to update our approaches. One such update is going to happen later this month, October 27th. We will be launching 2 Socrata websites. One is our open performance data portal that will cover the 10 indicators that are on my paper handout. But it will show sub-regional data by community, by neighborhood, so people can track how they're doing and how we're doing, and really helping everyone to live well. And the other is, remember that landing page, and I talked about all the data that we have, the community health statistics. We're going to free that out of PDF, and it's going to be in Socrata in machine readable format, ready to be used and create new charts and new landing pages for other people, and perhaps be ready for geospatial data analysis. So that's what we're doing. We're an old dog learning new tricks. I can't quite navigate everything, but we're trying, and we're trying to freshen up that approach and completely be more transparent to the community and help them activate them so they can be a part of that Live Well San Diego vision. Because we know that we can only live well if we all live well. So this is my quick overview.
Thanks, Dale. So I'm going to turn it over to Matt as well, and then I've got questions actually for both of them, and perhaps all of you will too. But any questions first for Dale and what she was talking about before we move on?
I'm wondering how you're able to gather local data, not how, but how you're able to present it when there are the issues that were previously discussed.
Most of the data that we're using is secondary data. It's ACS, it's CHIS, but what happens is we have a community health statistics unit that actually takes that data, analyzes it, and brings it down to sub-regional areas so that there can be no HIPAA violation. And if there are too few cases or incidents of something in a particular sub-regional area, they won't report it. So they have some internal rules to try and protect the privacy of people, and we're not using health record data. We're using population health data, hospital discharge, death, and ED discharge data. And Leslie, did I cover that correctly? Aggregated. Aggregated. Down to a sub-regional area, which is a cluster of census tracts, yes.
You know, it brings up, I think that's a really interesting question. I think it brings up an important issue that's worth noting. San Diego, I've found, among California counties, is one of the most sophisticated out there. Leslie is the chief epidemiologist in the county and has a team of people, in addition to herself, that have incredible capacity to analyze the data. In essence, this team of data scientists. But what I found in some of the counties that we're working with, that is certainly not the case, through no fault of their own. Think of a lot of the rural counties in California. We're also working with, for example, Lake County. As some may know, is just really devastated by the fires. It's an example of a data poor county. First of all, its populations are so small and rural that it's hard to get, good counts for things. And to make matters worse, I don't believe that they have a full-time epidemiologist there, whereas, in Leslie's case, she's got a team of them. So lots of issues to face. I'll turn it over to Matt, but I see one question over there.
Hi, I'm curious I'm a big champion of San Diego County, what they just did. But I'm wondering if we have thought about going deeper in providing almost a 3D effect of data where we can show, in mental health issues, for instance, if they had a domestic violence issue or some type of alcohol problem or a drug problem, and then they ended up with so the idea being, right now we know the person was suicidal or they're depressed, and it seems like it'd be really helpful for the state and for the counties to really be thinking about helping explain the whole story of not the individual per se, because it'd be redacted, but the storyline of that human, so that we can start finding deeper trends and data.
So that's great that you mentioned that. We're working now with Virginia Commonwealth University and UCSD on a project to look at big data sets and kind of, here's my technical word, smush them together to see to see what stories they tell us, what interesting outlier information, what stories that they confirm, but looking at social, physical environment, behavioral health, looking at health outcome data, looking at just a large and demographic data, and then looking at it across the region, so geospatially as well, to kind of pick out some of those interesting stories so that when we have our health improvement projects in our regions, that we can be more nuanced in our approach and more targeted and laser-like in how we're trying to bring everybody up in terms of health equity.
One more question over here. No.
Sort of a general question, but who are you preparing this data for? Yes, it looks great, but who's supposed to go find it online? What's the most interesting data is actually the mirror. So if I were an individual seeing my own private profile in context with this, which of course raises privacy issues, or am I a school teacher, or just who's supposed to be looking at it, and how do you customize it?
So it's only customizable in the sense that we can look sub-regionally at what's happening in your region. And in order to implement Live Well San Diego, we have about 5 different leadership teams that are within the different regions that are actually doing assessments of what are the issues, what are the high priority needs, and how do we come together as a community, again, across all sectors to address those needs. And so this kind of format can help people understand and grasp the issues right away. It can also be an action call for community convenings for students, for consumers, because we do have a livewellsandiego.org or livewellsd.org website where we try to draw people in to see stories and so forth. So I think it can be used in a number of ways. That's all I have.
And I think the spirit of the question is a good one, which is to say that, if we want to be able to tell stories effectively, thinking about that end user and how they're going to process the information and use it. And we're going to actually be doing some more of that in the next phase of this project. I think that's so valuable, thinking about that audience member. Lots of good questions. Hold those questions, okay, because I want to make sure we get to Matt. Matt has been doing some very interesting work. Marin County has been doing some very interesting work regarding prescription painkiller abuse and the stories that they've been telling with that. So, Matt.
Hi, everyone. It's great to just see the faces from our San Diego colleagues, because we're plagiarizing all the time off of you guys. So I'd never asked permission, but I can do it now. No, there's it's one of the, and we're less than 1/10 the size of San Diego, and one of the things that we've learned we need to do is take advantage of thought leaders out there, and one of the things I'll present today in terms of our report card around prescription drug misuse and abuse had as some of its early seeds the report card that you had all developed down there. So I'm the health officer for Marin County, 250,000 people across the Bay. And I thought I would talk about the way in which we have used the Live Stories platform around one specific topic, and that is prescription drug misuse and abuse. We entered into a relationship with Live Stories as a pilot county at a really good time for us, because we were just launching this initiative called RX Safe Marin, which is our community-wide coalition to address prescription drug abuse. And there were a lot of complexities around how we might represent the data around that issue that Live Stories really offered us an opportunity to iterate forward in terms of maybe using this as a platform for solving some of those challenging data needs. So this is I'm just going to sort of navigate how someone might use this in real life. So this is our website. Just to back up in terms of why this is a priority, in Marin County, when I became health officer 2 years ago, we saw that we were seeing a lot of, when I looked at the data as a physician, I'm used to looking at data for making decisions, whether it's individual patients or as a community, and the data led us to this problem. We were having 29 accidental drug overdose deaths every year in Marin. That's 1 every 2 weeks, much higher than state averages. So we used the data we had available to us, some minimal data, to gather the community together. Last year in June, we had about 100 people from law enforcement, educators, prescribers, pharmacists, people in the community that had lost loved ones to this issue, to really just brainstorm together about what do we do about this problem. And out of that grew RX Safe Marin. And RX Safe Marin is divided into 5 different action teams, and each has their own data needs. So if I just do the arrow, is that right? So these are the action teams. And these are based on the different domains that need to be part of the solution around prescription drug misuse and abuse. We have a community-based prevention team, treatment and recovery, prescribers and pharmacists, law enforcement, and then the red team, which is a data collection and monitoring team. So we actually have a dedicated team specifically for feeding the other action teams around the specific domains with the data and information they need. Each of the teams has come up with their own very specific goals for what they were trying to accomplish in the first year of our efforts. One of the goals for the data team was developing a report card for this, for the rest of this effort. And this is the report card, and that's a lovely pink color. This is and it iterates between pink and blue. I'm not sure what it's like obstetric. Anyway, so the report card, we basically went to the community and said, what are the 10 things? You got to pick 10 things, no more than 10, that you think are the most important things to measure in this process. So there was a solicitation from the community itself in terms of what they thought were the things that were most important that we should measure, and then iterating that with what's available to us in the way of data. And then we tied those to some of the goals of the different action teams. I want to call your attention to one of the data elements. So I'm a co-lead of the prescribers and pharmacists action team. And we're trying to, as one of our goals, encourage prescribers to register for Cures. Cures is the database where all controlled substances prescriptions are held at the state level. So if a prescriber is considering prescribing a controlled substance for someone who has pain, for example, they can look into Cures and say, John Doe is here with pain now. Did he see someone in the last week with the same complaint? And I've used Cures as a provider, and it's really very helpful, because sometimes you can be about to write a prescription, and it turns out they had been seeing someone the day before and had the same prescription offered. And it's a way of preventing doctor shopping. So we wanted to encourage our prescribers to use Cures, and one of our agenda priorities for RX Safe Marin was doubling the number of prescribers who were registered in Cures between 2013 and 2014. So there's our goal. It's a community priority, and it's a data element that we want to be able to show to our community. So we here see in 2013 we had 149 prescribers registered in Cures, and in 2013 149. In 2014 we have 319. So we reached our goal, and we more than doubled the number. And this is a data tool that allows the community that participated in the process of developing that as a goal to actually see that goal is achieved in real time through something that's available to them online. And there's 10 other indicators, or 9 other indicators, that are similarly linked to community priorities. The alternative would be, just thinking about sort of from a public health department standpoint, the alternative would have been a PDF last year with 149 prescribers, and then some description that we had a goal that we wanted to double that, and then having to put out another PDF at some point with the new number. But how would that relate to the other elements that were also described on the report card? Did you put out a new report card in PDF format every time any one of the indicators changes? There's 7 different data sources for these 10 indicators, and they all are in different time sequences. And we want to make sure that the community is getting timely feedback, because they are invested in reaching these goals. So it's almost like a organizational motivational psychology tool that you're saying, we've set this as a goal. We want to watch if we're able to achieve this goal. And here's a tool that they can look at and see and actually monitor when those goals are achieved. So this is something that we would not have been able to do had we reverted back to this sort of static PDF format. The other dilemma with the PDF is that when you have it out, as 2013, you see 149 prescribers. That's out there. It's a file, people are printing it, it's sort of in circulation. It's very hard to change the narrative when it has a concrete manifestation out in the community that's constantly changing. This effort, there's an urgency to this effort. It's been going for a year, and people are interested in how we're doing. So we need to be able to offer timely feedback that can only be offered by a live online tool. And the PDF just wasn't able to offer that sort of timeliness that we needed. So that's one homegrown, small county effort at how we're using live stories to bring data to life, to inform and motivate important local initiatives around public health.
I'll have a few questions for both of them, but any questions? A lot of questions. Great. Here we are.
Yeah, question for both Dale and Matt. You guys have chosen great examples of data visualization and data storytelling. Are you guys trying to hire for those skill sets in your organizations? And if not, how are you cultivating kind of appreciation or organizational prioritization of these things?
We are, as a county, hiring. I don't know about the visualization part. We have a way to go there. But I have, for instance, it's fragmented right now. I have a Live Well San Diego team that brands the Live Well, the logo, the color, the website, and they try to infuse that branding in these other products. But in terms of data analysis, we have the epidemiologist shop that Leslie runs. We have epidemiologists threaded throughout the public health programs that connect back with Leslie, so she's my main go-to, because I know nothing about this, as you noticed. And then we have a team of operations research analysts who are more looking at internal data, the HIPAA-protected data, and how that external data that Leslie works with, when it hits the agency, how does it affect the programs and those internal data sets? And so they're trying to get into the world of predictive analytics and so forth. That is our newest people acquisition in terms of skill sets, and that's operations analysts, because we realize that we were letting our processes drive us rather than learning and knowing our processes and being able to get in advance and ahead of them and drive them. And we learned that with the downturn of the economy and the blow up of our welfare, our public assistance programs. So.
I mean, for Marin, I'm not sure we've really, I mean, societally defined who that is, right? This is exciting middle ground, and I think it's kind of between like where you all are in this Code for America and sort of where we are on the EPI side. Like, I was at CDC for a couple of years. You know, there's a lot of rigor, a ton of rigor in terms of like what is actually like the p-value. You know, I mean, there's so much effort put into like making sure that it's accurate. But it's almost like, I was trying to think of an analogy for it. It's almost like you paint like this beautiful mosaic, you know, on a wall. But instead of putting it in a museum, you put it like, in order to see it, you have to look through a keyhole. Like the people are lined up looking through this little keyhole, because like we need to find a way to sort of have that rigor that's in the background actually manifest. And we don't, I mean, I think it's almost like a gift. Like some people just happen to have that ability. We have a CDC fellow embedded within our organization for 2 years at a time, and she's here today. Haley is with us today. And it's one of the things that we're actually trying to sort of foster in terms of a skill set for people who are trained in conventional epidemiology to really think about, and this Live Stories is one tool for that, to really think about how do we actually get it out. But I'd love to know more about kind of who that person actually is, and we would definitely want to hire for that.
We face that too. That's a really good question, because I think we face that too as a foundation that's trying to nurture this in communities across California. And one of the models that we looked at is, well, what if we as a foundation could hire data reporters, natural storytellers, right, for every community? And we realized that that's not really scalable, quite honestly. And so for this next phase, one thing we're going to try and do is to do a very template-driven approach. To come up with stories that not only might matter to a particular community, it might be the weekly flu reports, it could be, you know, prescription painkiller abuse, and to be able to template that in a way so that it can then be plugged and played, you know, through other counties, that other counties can easily copy that and use that. So that's what we're hoping to do and build it out. Next question.
I guess I have a question that leads from that. So, full disclosure, I work for a news agency. And I see this, and I see this as a pretty nice attempt to publish self-publish. Has there been any effort to collaborate or work with news agencies that actually already have an actual audience or community audiences, and perhaps may need some collaboration on these kind of publishing tools? I'm kind of wondering, some of these look really nice, these Live Stories, but does anyone see them?
Good question.
Well, no. That doesn't matter. Another website, like, does anyone go to this? Does anyone see it? So I'm curious, this seems like a really good step, but is anyone seeing it? I think you're making a great transition from the PDF to publishing, but how are you doing with getting it into the community?
So we haven't really launched it hardcore to the community, but we do have, in our county, we have one news agency and they get tired of us. So our, you know, another press conference. So our county communications office has created a county news center where they post pretty much already completed news stories that people then follow up and do their own news investigations from. But I'm thinking that that will be the launch point for us to make some of this available, clickable through that county news center to get the word out to the community. And that goes automatically to all of the news outlets, both video and print, and it gets to the smaller news agencies too, importantly, who can't create their own material, and sometimes they'll just lift and load into their own material. So that's the way we do it.
I think it's important to create an appetite for the data. I mean, some of it is this cultural change in terms of what people are looking for. They're not going to, even if you give them the data, if they're not interested in or understand the value of the data, it won't register. So it's not just access or even touch. It's awareness of relevance. And I think we do that through, when we talk about prescription drug misuse, any chance I get, whether it's the Board of Supervisors or a newspaper article or whatever, I talk about our metrics. So we're looking for a 15% reduction in narcotics in Marin County in 2015 relative to 2014. 15 and 15, it's got a catch to it. So you want people to start, and then there's like, okay, well, you've confessed to a goal that we're going to measure, and we can see where you are relative to that goal. So I think some of it is actually just raising, the community's awareness of the fact that data itself is necessary to the narrative and the dialogue, so that they're, wherever you build it, they're actually interested in looking for it, and then making it available.
It's with this county project, this is something where we're learning as we go, and I think one of the things we're learning is that it's a tough process for all of us to create data products that are compelling, and then the next stage that we really want to work with the counties on is the dissemination piece. I think you're absolutely right. We've had, for the open data project, the one that Joel was talking about, we've been getting a lot of traction, not a lot, some traction with the press. Fresno Bee did a whole series of stories that used data from the open data portal. And the state, interestingly, came to us and said, we want to bring an opportunity together for the public information officers in all of the state's health departments, health and human services departments, to meet and to connect with reporters so that they can learn from them. So there's some of that going on. Needs to be more. But let's see, who hasn't had a question all the way? Can't remember if you had a question, but yeah, you, yeah.
It seems like foundations in the state, the foundations and maybe corporations, and especially Code for America, could work on data standardization because one problem is San Diego County counts suicides one way, the LA County counts another, because one's done by the sheriff, one's by the medical examiner, and it's very difficult for the state to tell a story. So I'm glad they're working on PR, but it seems what we need to be working on is benchmarking, being able to, if we standardize data, we can benchmark a lot easier, we can look at interventions, we can look at results much more quickly, we can replicate each other's best practices more quickly. So it seems like one of the foundations that's missing is the fact that counties have really grown in silos, and they've all developed to a certain point, and many are advanced and a lot are falling behind, just largely because of financial resources. So it seems like there's a really strong need for a data standardization and then best practices portal of some type, and let innovators come in and see that data, and maybe we could be working together a lot better.
That's a fair point. I think the open data portal for the state hopefully will partly serve that function, I think, having the standardized data sets. But
yeah, if I could jump on that, that's part of the conversation we had at our local roundtable. A lot of what sort of local social services people wanted is, we all provide these services, and there's 2-on-1, but it's really hard to get information up and down and in and out and try to understand what everybody is doing. And so one of the things that they really floated is we'd like a centralized place that we can say what all our programs are and everything that we're doing, so that there's one repository, and then you can build whatever app you want to get the information out, and you can have a standardized a bed placement service and all this kind of things, but it all centered around being able to standardize the data in a certain way. And there are definitely efforts out there. There's the Ohana API, which was a Code for America fellow project a few years ago. It's built into open referral, and there are efforts, but there are there's a ways to go in making that all happen, and there are some people dedicated to working on that kind of stuff, but it's going to take some time, I think.
Great. There's a question all the way in the back.
Hi, I have a question coming from the government and nonprofit sector, specifically a smaller nonprofit. I'm curious, Gail, you said that you transferred this 50-page report on suicide and helped create this awesome live story feed with the suicide reports. What does that look like internally as a structure? Who is dedicated to working on this, and how do you train your current staff to be able to continue adding on to this? I'm sure it costs money, it takes time, and not every organization is outfitted with a web designer and a software engineer. So I'm just curious if you could share a little more insight on how you made that transition from PDF papers to a constantly updating page.
With the help of the California Healthcare Foundation and the Public Health Institute, and with Adnan from Live Stories. But Andy and I did talk about how do you make this sustainable, and that's where this idea of templates that. And even beyond templates, what if you have your own story that you want to tell and for the smaller organization? Because we have small bands of resident leaders that go out and they're like an army of people that are trying to do policy systems and environmental change work. So my thought was PHI, if they could give us, okay, I'm making the big ask here, graphics that could be easily used, tips for how do you simplify your narrative so you can click and fill in that information. Because we have on our livewellsd.org site, we have blog stories, but nobody knows how to blog. I don't know how to blog, but we have a template that you fill in the blocks and then it magically turns into a beautiful story with pictures here, subtitles, quotes there. So I think the same theory could occur with live stories, or I just think it could happen that way, where you provide people with clip art, with so when we came, I have to confess that Adnan made this look beautifuler. It was beautiful, but he made it look beautifuler for today. And so, so even if they had a library of clip art or photos or things like that that people could plug and play in, and then suggested templates for if you're trying, what kind of message you're trying to deliver, if you're trying to drive action, if you're trying to inform, if your audience is policymakers, if your audience is consumers or other advocates. I think that there are some things that you could do to help others help themselves. That's just my pitch.
We don't have the bandwidth to do, a small count, most people in the state, a lot of people live in small jurisdictions, taken together. And none of those jurisdictions individually has the bandwidth to do this. So there's this sort of gap of what the population would benefit from. There's the dark side of the narrative of local control, right? We do want local stories and local data, and the local voices are the most important ones. The problem is that often leads to a sense that you need to have locally derived products, which are often terrible because you don't have the knowledge or the bandwidth, so the idea of plagiarism, it's sort of only semi-joke, we do cut, I do a lot of cut and pasting from San Diego and other, because if it's a best practice and it's the right thing and it looks good, it's the same problems, right? Diabetes, hypertension, it's not because you're diabetic in Marin County, somehow categorically you need a different background in the picture of the diabetic person. So I do think we need to get over this idea of locally derived products towards a standardized high quality products that are actually in place in some of the, Los Angeles County, San Diego County. They have teams of people that are doing really high quality work.
My on that point, the other day, my son, 10-year-old son, he's using iMovie, right? iMovie, the Apple thing. And he made this amazing movie. He's not a director or anything like that. And he made it look incredible. And my first thought when I looked at that, I thought, that's where we're going with data stories, We're getting to the point now, seriously, where the tools are becoming plug and play enough that we can drop in the graphics, we can drop in the interactive maps and charts, and it's going to look stellar, and it's going to be better than having each county do their own, inferior product. So hopefully we're getting there. We are seriously out of time. We're going to be around for a little bit,
Can I just make one quick comment?
One quick comment.
Okay, I love that you brought
So, yes.
Community meetings, planning meetings, and more. How can you convert what you got online, get PDF, get a nice PDF to hand out? It's a comment, not a question.
It actually, the technology is built into here. So you can convert this into a PDF.
Right, but it's different, but the
Well, that's true, yeah.
Yeah, I
I
printed
was going
mine.
to say, actually, if you want to almost explore that a little bit more, at Adnan from Live Stories, what time today? I forget, I want to make sure I get the time right. 4:30 in this room, there's actually going to be a session, a data storytelling session, using Live Stories platform. You're welcome to come. Everyone come up if you have questions. Great, thank you so much.